Rob, you talked at one point about remyelination. Did I hear that correctly?
You did, yeah. So we've talked about this in the visionary study. So this is the MS study, and let's just explain that study for a moment, because you're correct that remyelination has been certainly a bit of the holy grail objective for so many drug studies. So what visionary is, I think it's important that I set back up the study for just a second. So originally we did a 48-week placebo-controlled treatment period, so nearly a year. And we enrolled stable, relapsing, remitting multiple sclerosis participants, and all of them had to have chronic optic neuropathy. So, in other words, compromise of their vision, and they had to be on background disease modifying therapies. So, these were patients that were stable. They had to be 6 months free of any previous lesion. And the average actually was for 3 years. So they had no recent MS compromise from new MS lesions attacking their neurons, but they nonetheless had vision compromise. So what we did is we randomized them to either placebo or our asset, CNM-Au8. And again, when we say placebo in all of our clinical studies, I'm holding up again this asset. If I was to drink this 60 mils and I was blindfolded and I was drinking my water glass, I would not be able to tell the difference. It tastes like water because it is mostly water, as Mark can give a little bit more color to in a second. But speaking of color, no pun intended, you see that it's purple. So the placebo is simply purple colored water. Purple colored water is what we use as placebo in all of our studies. In fact, one of our early challenges was to figure out a purple food dye that did not have any taste whatsoever, so it could be unblinded in placebo studies. In any event, half the patients were on placebo, half of them were on AU8. We followed them for a year. The primary endpoint was trying to assess if we could improve their low contrast vision acuity. So what this is, for people that may be less familiar, when the MS lesion hits my optic nerve, I lose my ability for contrast vision. So in all low light conditions, I get vision compromised. Walking to the mailbox at night, reading a menu is typical. I'm in my late 50s now, so sometimes in restaurants, I need to pull out my cell phone to illuminate a menu if I don't have any reading glasses on. MS patients have to manage these problems all the time in low light conditions. And so literally what we did is used a classic Sloan chart, which is similar to an optometrist chart that one would see if I went to get a vision exam for my glasses or contacts. I literally look across the room at a defined prescribed distance and I read O, Z, D, V, K, Z, V, C, blah, 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 on the letters. And we counted the number of correct letters that folks could read. That was the primary. The secondary endpoint was a composite endpoint looking at fine motor control, cognition, my ability to walk 25 feet down a hallway, and my speed of that ability, and then vision. So I had 6 components on my secondary endpoint, 1 on my primary. And the reason we talk about remyelination is because we followed those patients for 2 further years in open label. So 12 months of double blind. Then everybody had permission to roll into open label. 90% of patients chose to go on active drug. And then we followed the original placebos plus 2 years of active versus the original actives plus 2 years on original active. And what we saw is we did some very interesting work with visual evoked potentials. Now, what that basically means, again, this gets a little bit wonky, but we're understanding the speed and the amplitude of the signal when my eye sees this back to my visual cortex. So signal strength is amplitude, signal speed is latency. And we're evaluating that with a specialized device called visual evoked potential. And we're seeing both improved latency and improved amplitude. Now, if I improve my amplitude, that is associated with an improved axon integrity, meaning I can push more signal into my visual cortex. If I see latency, that is actually associated with evidence of remyelination. So a compromised optic nerve, if I have more latency, so more speed, signal speed is able to move down, it suggests faster conduction velocity and by consequence, remyelination. That's not the only thing that we did to assess this. We also tried to assess advanced MRI techniques. And what we did in that instance, same study, is we evaluated people during this entire 3-year period, again, 12 months of double-blind placebo control and 2 months of follow-on, and we looked at what's called their myelin water fraction with an MRI machine to understand the degree to which we can actually see more axonal integrity, less axial diffusivity, in other words. And by looking at the myelin water fraction with this advanced MRI technique, we can actually look into the brain and see if we can improve how patients are actually doing with respect to myelin water fraction. And in the cerebrum, we think we see evidence of remyelination therein. Now, all this study in MS needs to be repeated in a phase 3, which at the right time we are planning and will commence.
Interesting. Yes. I was going to ask you about cognitive impairment. So you actually looked at the cognition. Did you see any result?
Yep. So this actually is presently there's a slide on our website that any of your viewers can certainly go look at when we talk about this visionary study. But let me talk about it. So what we do in MS is we use the symbol digit modality test. So this is a substitution cipher. So what we do is patients take this test, classic test in MS, where they basically have symbols and numerals, and they back solve equations with symbol digit modality. And then we literally count how many correct, it's literally a score by numerals. And we saw in the original active group, by the end of the double blind, about a 5-point change on symbol digit modality in the actives versus placebo. And that was incidentally significant. It's interesting, though, because such an improvement of 5 points on SDMT, again, symbol digit modality test, is about the equivalent of somebody being able to go back and work again. In other words, their MS had caused cognition challenges such that they had, as one MS patient explained it to me, a cognitive fog, or he said cog fog. He just felt blurry in his head, and it caused compromise of his, daily activities of just cognition. And that 5-point improvement was quite significant. But what's more interesting to me is 2 things about this study. We then followed them, as I've said now twice, for 2 further years. And by the end of that 3-year total period, the original actives had improved about 7.5 points on symbol digit. So quite appreciable improvement. But the second piece that was equally impressive is the placebo folks that had not seen cognition improvement during that first year. We then rolled them onto active drug. After 6 months, when they started to get into steady state and flow blood levels of our asset, then they nearly replicated the same improvement that the original actives had seen. In fact, I've got a graphic showing both the remyelination and the cognition improvement on our website presently in our investor deck, if somebody wants to go see that. And we've also presented this at the American Academy of Neurology in April of this year, and there's a press release related to that. So in other words, this improvement, even though the patients had had functional compromise, despite full DMT tamping down their MS lesions, they were compromised cognitively, and AUA over the course of this first year and then 2 further follow-ups improved that cognition.